Leave the dressings intact until your review with us at the 2-week mark. It's important to leave the dressings intact and the wounds covered to ensure that your wounds heal. Yes, the dressings are waterproof. You can shower directly over the dressings, but we strongly suggest that you do not bath over the dressings. After they are wet from your shower, please pat them dry. Look after these dressings, but if they do become breached or waterlogged, either contact your local pharmacy, local doctor, or our clinic to have them replaced. Yes, you do have stitches. Most of the stitches are dissolvable and do not need to be removed, and we will review the wound at the 2-week review. If you do have non-absorbable stitches, we will remove this at your post-op follow-up at the 2-week mark. Please check your operation note and in particular the post-operative instructions section. The duration of your sling will be clearly written in this section. It is best to use the sling overnight for the first 2 weeks. Thereafter, it depends on whether you are able to control your arm while you sleep. If you do not have the ability to control your arm while you're sleeping, it's best to use the sling. Otherwise, you can remove it at the 2-week mark to sleep comfortably overnight. Yes, you can. It's important to remove the sling 3 times a day initially to complete some early post-operative exercises. You can otherwise remove the sling if you are resting and sitting at home and resting your shoulder during that time. This will be directed by your anaesthetist and by the pharmacist in the hospital, and please refer to the pain management guide that you have in your operation report. There will be clear instructions of what medications to take, at what frequency and for how long within this guide. Generally, you will start taking pain relief from the night of your operation, and we suggest that you take pain relief for the first 2 weeks to help you recover. Generally, the pain will start to subside, and at that stage you can start to wean yourself from your pain medication as this occurs. Please contact your local doctor or our clinic for assistance. Note that you will see us at the 2-week review, so if you require more pain relief, we can organise this at this next appointment. Perform the exercises as instructed on the post-operative exercise guide, and also with the helpful video showing you the early exercises to have performed. We ask that you complete these exercises 3 times a day and perform them as 2 sets of 10 repetitions. Please make an appointment to see your physiotherapist at the 2-week mark after your operation. It is best to avoid driving until your arm is no longer in the sling. Our general advice is to wait for the 4-week period after your operation. If you do need to drive, it's important that you are safe to do so, and to comply with Victorian road rules, you must have the ability to control the vehicle safely. When you are comfortable enough to return to, and it's dependent on the procedure that you've had performed, best advice is to have 2 weeks off to recover after your operation from the general anaesthetic. You will need to see us or your local doctor for the 2-week appointment and post-operative wound check. If you are due to see us in the clinic, we will call you after your procedure and organise this appointment. If you are to see your local doctor, we do ask that you make this appointment yourself. The other important appointment to make is with your physiotherapist, which is at the 2-week mark. Please ask us for this on the day of your operation. Otherwise, we will see you for the 2-week review appointment, and we can organise your certificate at this review. We can complete this on the day of your operation or at your post-operative review at the 2-week mark. Your physiotherapist is also able to complete these certificates for your ongoing care.